What's up, everyone? So today we're going to talk about knee pain. And oftentimes I have a lot of patients that ask, running, does it hurt my knees? Should I stop running when I have knee pain? Should I run through the pain? And the answer is, it depends, as always. So today I have Aaron here again. We're going to talk about different knee structures that seem to affect people that run more commonly than others. And then we're going to go through a few different movements that tend to minimize some of that discomfort, again, trying to strengthen everything around the knee. Okay, so when we look at different knee anatomy, we think about four major groups that control the knee. We think about our quads, which are the muscle group that are on top of the knee. We think about our hamstrings, the muscle group on the back of the knee, our glutes, our butt muscles, and our adductors, our inside thigh muscles. When these groups all work in harmony, we tend to not have too many problems, especially in regards to knee pain. But when one gets a little more angry or a little more overactive, perhaps, it can wreak all sorts of havoc and cause different types of sensations throughout the knee. A common one we see, obviously, with runners is something called IT band syndrome. Well, we don't really call it IT band syndrome because it's actually not an IT band problem. What it is oftentimes the muscle group up in the hip that's overactive, or you have an overactive inside muscle group, your adductor group. A lot of times this kind of push, pull, balance gets out of whack, and then we get different symptoms like lateral knee pain or sometimes even medial knee pain, depending on which muscle group tends to be the culprit of the problem. Another common one is like runner's knee or jumper's knee that we get, where we kind of have this irritation in the lower part of the kneecap. We call this the infrapatellar tendon. And a lot of times this is associated with little kids that have Osgood-Schlatter's disease or Sundin-Johansson's disease. Different types of problems and growing pains, and a lot of times in adults they get pain here and we call it Osgood-Schlatter's disease. It's not really the same thing. It's more of an infrapatellar tendonitis problem typically, but oftentimes it's not even a tendonitis problem, it's just where we're feeling the pain, and the muscle groups, again, typically the hamstrings in this case, are a group that often is a culprit for this. Sometimes it can be quads too, and again, it varies. The answer is, where is my pain coming from? It depends. The good part about it is if we strengthen the area around the knee, we tend to minimize the pain and improve the function. So I'm going to walk you through a couple of different movements that'll help with knee strengthening. We'll do a hamstring area, and we'll do a quad area, and then an adductor area. Okay, so the first one we're going to do is called a hamstring ball curl. So step one, I want Erin to put her feet on the ball, and I want her nice and relaxed with her arms spread out for balance. She's going to lift her hips high, pushing her heels down into the ball, and then she's going to roll the ball back in, curling it into her hamstrings. Good, and back out. Perfect. Hips stay high the whole time. Again, you should feel this on the posterior thigh and the hamstring region. Nice and smooth, nice and simple. The second one we're going to look at is called the Copenhagen adduction. Again, this is going to be for the inner thigh region, or adductors, hence the name of the exercise. So Erin's going to lift her hips high. She's got a foot planted up high. Lift her hips. Perfect. Pushing the floor away with this shoulder, maintaining a nice strong shoulder here. She's then going to bring her bottom leg up and down. A regression from this exercise can be just holding it in a plank in a neutral position like this, maintaining and making sure we're pushing down here with this top foot, strengthening this upper inner thigh. Beautiful. The third exercise we're going to look at is called a sissy wall squat. So Erin's going to have her back nice against the wall. She's going to drop her butt down just like a typical wall squat, getting that 90-90 angle. And then the last step she's going to do that's a little bit different is she's going to lift her heels as high as she can, really activating the back part of our calves and as well our quad group. In this position, you're strengthening your quads. You're at max contraction and max load of your quads. So this can be a little touchy on knees, but oftentimes I find that patients find these exercises very relaxing, and they even minimize pain just by activating it in an isometric fashion.